Welcome to this edition of Best of the Best, where we interview the world's leaders in healthcare, politics, sports, and business while sharing their secrets to success. Now here's your host, Dr. J. Murray Hawkins.
I'm excited to interview my next guest, Dr. John Burd. He is the author of over 40 publications and holds 35 patents. Wow. We only have one patent, so I know how hard it was to get one. I can't even imagine getting 35, so that's incredible. He graduated from Purdue University with a BS in biochemistry and earned an MS and PhD in biochemistry from the University of Wisconsin. In 2010, he was inducted into the American Association of Clinical Chemistry Hall of Fame and received the Ullman Prize for Innovation in Clinical Chemistry. He was the founder and CEO of Lysulin, Inc., which is a diabetes management company. And in 2018, Lysulin launched an all-natural, scientifically proven nutraceutical product proven to improve the health of people with diabetes. Before Lysulin, he was president and CEO of Dexcom, which is now the leader in glucose monitoring for diabetics. Prior to Dexcom, he was a general partner of Windermere Venture Partners. In 2019, he founded Wonder Spray LLC to bring an amazing natural product to people who need it. And Wonder Spray is EPA registered for COVID-19 disinfection and is useful for a long list of ailments. Dr. John, welcome to Best of the Best. Glad to have you on.
Thank you. There's nothing more I can say. You said it all. Thank you very much for the introduction.
All right. So first thing I want to ask, so why do you feel there's been such an increase in type 2 diabetes the past 30 years? It's really been incredible.
I have an answer to that, and that is it's because of an evil conspiracy between the government, big pharma, the food industry, and the medical community. And what they're conspiring to do is to keep the Americans obese, diabetic, hooked on multiple prescription drugs, and yet still sick. I mean, it's just sad how so many drugs get prescribed for diabetes. It's like when I started this back in the 70s, started thinking about diabetes, there were like 4 drugs for type 2 diabetes. There's now over 70 different drugs. And all the drugs and everything are directed toward the symptom of high blood sugar, not toward the cause of diabetes, which is glucose toxicity, which I'll talk more about in a bit. But anyway, this conspiracy is really simple. The government in 1980 launched this wacky food pyramid that said everybody should have high-carb, low-fat diet. And if you plot on a graph the number of people who are obese and have diabetes versus time from 1980 to the present day, it just is like a hockey stick, because basically high carbohydrate means high glucose. That means eventually insulin resistance and diabetes. And the pharma industry, the reason the government in 1980, I believe, recommended that high-carb diet was because of the farmers. We have all this corn and wheat, and they had to do something with it. It was before trying to make ethanol out of it. And so they wanted to make corn flakes and Wheaties and frosted flakes. And they put sugar in everything. The food industry put sugar or high fructose corn syrup, which is a whole story on its own. That's the devil's work, high fructose corn syrup. And the result is people just get sick because they're poisoning themselves to death with glucose. And actually, as I mentioned before, I've written a book about it, which is called The Natural Solution to the Diabetes Epidemic, The Discovery of Lysulin. And that's on Amazon if anybody's interested. But basically, it talks about this conspiracy to keep people sick and on multiple drugs. So,
yeah, and
sorry
again,
to be
I've talked about that for years too in my seminars all over the world. That again, big pharma, they're not in the business of curing disease; they're in the business of managing disease with medications. And if you're taking one medication, they'd rather you be taking 10 medications. You know, just like if you're a tobacco company, right? They don't want people smoking 1 cigarette a day. They want you smoking 3 packs of cigarettes a day. And so that's the business they're in. But again, because of all the commercialization and you know, again, they dominate the airwaves as far as magazine, radio, TV, et cetera, as far as advertising. And so they're they're making it seem like it's just a normal thing to be taking 5, 6, 7 medications. Kudos to them for a phenomenally brilliant marketing campaign the last 40 years. But again, now we look at, because of all the medications people are on, such a high incidence of people with diabetes getting on dialysis and kidney failure because of all the toxicity from the medications on top of the diabetes. So it's just, again, they keep creating different diseases. And again, you and I could probably talk for hours on just how it's just such a huge business, a multi-trillion-dollar a year industry. And they do it by disease management. And that's kind of where you and I are sort of the black sheep, because we're actually trying to get to the cause of this thing. And instead of just keep on treating the symptoms. So it's really insane. And the part that I don't know if you feel this too, Doc, but the part that I feel bad about is a lot of these physicians, they really care about their patients, but they don't know what they don't know. Like in med school, they're trained, diagnose a condition, treat it with the medication. That's it. That's like the only tools in their tool belt is treating it with the medication and then surgery. They're not trained in wellness in any of the way that you and I have been trained. They're not trained in that. And so they don't even know. And the sad part is, even though they don't know it, a lot of them poo-poo it and make it sound like, oh, that's hocus pocus, that all that natural wellness stuff, without really looking into it. So that's what I've seen. I don't know if you've seen the same thing or not.
Yeah, I've got 2 comments on that. One is that since the beginning of time, intelligent folks have realized that food is the best medicine. And, I believe that. I believe if you can get off of carbohydrates, your health will improve so dramatically that it's amazing. That was one thing. What was the other thing about, in pharmaceutical companies, the doctors get no nutritional training when they're in medical school. They get an hour out of 3 or 4 years or 5 years. You were in med school. I am not a medical doctor. I'm a PhD. So, but I think you as a medical doctor know that you didn't get very much
I'm not, John. I'm sure we're clear. I'm a doctor of chiropractic, not a medical doctor. So
I'm sorry. So you don't have that experience then. But I think that doctors, MDs, get no nutritional training, which is tragic, because the diabetes educators that work for these folks, they know more about nutrition than the doctor does. But diabetes educators, I love diabetes educators, but unfortunately, when I try to convince them to use our products, for example, they say, oh no, we can't do that. The doctor has to prescribe all the treatment. We just talk to the patient and blah, blah, blah. So that's really, nutrition is just so important and so undervalued in our healthcare. So,
and to hold the certified diabetes educators and the diabetologists and the hospital classes that all doctors send their diabetics to learn how to eat better, it's all about how to manage the diabetes. So they'll give them some suggestions, hey, lower your carbs, do a little bit of exercise, but keep taking those meds, right? They never utter the words, hey, if you do this, you can reverse your diabetes and get off the meds. So it's like the American Diabetic Association for 70 years. They're in the management of diabetes as well. They don't ever talk about how to reverse it. They'll talk about, hey, send us money because we're looking for the cure, which they've been looking for 70 years, that they're not going to find as far as, a medical thing to cure it. But that's kind of that whole game. It's all about stay on the meds and maybe hopefully it won't get worse. That's that whole mindset. And so, I agree. The diabetes educators know more about nutrition, but still they're in the management of diabetes game as well, which is sad.
Yeah, actually, that's a really good point, because doctors, and I believe their patients, think that the diabetes is a one-way street. One-way street to eventually insulin injections, where you become a drug addict, where you have to take insulin shots and you have to take more and more and more, because it works less and less and less. And their belief is that it's a one-way street. But people like you and me believe that it's not. You can make a U-turn. You can reverse diabetes. And that's so controversial, even though there's so much data that proves that people, if they will just eat right and maybe exercise a little and fast a little, that they can reverse their diabetes and get off drugs. I love your program, as you know. That's why I'm so happy that we're connected.
Yeah, I mean, it's absolutely reversible. And so to deny it is ridiculous. Even before I started, I found, minimum of 25 independent medical references that says you can reverse type 2 with proper lifestyle changes. But again, that's not taught in medical school. So let's jump into some other things here now. So give me the definition of what is glucose toxicity. Now, that's a big thing that you talk about as well.
I love to talk about it. It's like I had never really appreciated it until one of my co-founders, who's a MD nephrologist at the University of Wisconsin, Dr. Stuart Updike, I was sending him information about some dialysis products for people with chronic kidney disease. And that's another terrible disease that half of people on dialysis have diabetes. And he said, don't mess around with this dialysis stuff. It's fine as it is, which I don't believe. It's terrible as it is. But he says, why don't you work on something important like glucose toxicity? I had never heard that term before 2017. And I think I'm now an expert in it, because glucose toxicity, as it turns out, is the chemical reaction of glucose with all the proteins in your body. And we need glucose for energy. Obviously, our brains are swimming in it because we need it to keep our brains active and functioning, and our muscles need it to allow us to move around. But other than the energy needs, you get too much glucose, it's in your bloodstream, it reacts, forms a chemical reaction with all of your proteins in your eyes and your nerve endings and your kidneys and your blood vessels. I mean, there's so many, glucose is killing us. And I thought, well, wow, so this is a chemical reaction. And as a biochemist, I thought, how can I stop that reaction from happening? And the answer was simple, lysine. And lysine is an amino acid, which is in all of our proteins, but we don't make it in our body. You have to get it through your meals, through your diet. And so we have lysine in our bloodstream now, but if glucose is like, let's say, 100 mg per deciliter, lysine is about 0.4, so it's like 200 times less in your bloodstream. And I thought, wow, well, if people will just load up on lysine, the glucose now would have a choice. It could either react with your proteins or it could react with lysine. And if it reacts with lysine, you form glycated lysine, and you just excrete that in your urine. So it's Lysulin, which has a high amount of lysine in it, soaks up that glucose before it can react with your proteins, and you just excrete it. So it's like a sponge that soaks up that glucose and keeps you healthy. And, one of the other thing about ours is a diabetes supplement. It's got lysine, zinc, and vitamin C. And the zinc and vitamin C also improve glucose levels after a glucose tolerance test. And this has been also studied and published, well known that both of those are important compounds. So Lysulin contains lysine, zinc, and vitamin C. And we now have double-blind, placebo-controlled studies that prove how well it works. And it works great. It works for 70% of people who use it. And I wish it was 100%. And I'm going to keep working towards that goal, but it's only seems to work for 70%. And what else can I say about it?
So let's keep on that. So how does the Lysulin actually stop the glucose toxicity and improve insulin resistance?
Well, it as I said, it acts like a sponge to soak up that excess glucose. Insulin resistance, as you know, this is insulin, and this is your cell. Well, there's a receptor on that cell, and the insulin fits into that receptor to open the door to allow glucose to enter. Well, both insulin and the receptors on the cell get glycated. And let's say this is insulin. I react glucose with it. It looks different now. It doesn't look like unglycated insulin. And the receptors on the cell, they change their structure too. So the key no longer fits in the lock. And that's insulin resistance. And Lysulin, stops that reaction from happening. And I'm not making this up. I can send you a publication that documents that. diabetic animals that have lysine in their drinking water do not glycate their proteins. Their levels are just like people that are animals that don't have diabetes. So it's proven that it stops that protein glycation, glucose toxicity, which is the cause of insulin resistance and type 2 diabetes. And in one of the studies we published, we looked at insulin levels and insulin resistance, and this is in people with pre-diabetes. And at the end of their 6-month study, they proved that their insulin resistance improved, and it slowed the progression from pre-diabetes to type 2 diabetes. So it's amazing. And again, as a nutritional supplement, we have to be careful because we have to put this black box label on our bottles that says the FDA hasn't evaluated this product. It's not intended to diagnose, treat, cure, or prevent any disease, even though it does in fact treat, help to cure and will prevent the progression of pre-diabetes to type 2 diabetes. And I'll tell you, you really have to walk a fine line about what you can say publicly about nutritional supplements and vitamins, as you know.
Well, okay, so does Lysulin actually help type 1 diabetics as well as type 2?
Actually, that's a great question. Thank you for asking. The Dexcom, the continuous glucose monitor, was primarily made for people with type 1 diabetes, but type 1 diabetes is an autoimmune disease. Type 2 diabetes, as you know, is a lifestyle diet disease. Type 1 diabetes, your body attacks the pancreas, and the pancreas no longer makes any insulin. So you have to take insulin shots to survive. It's also interesting, before the discovery of insulin, the treatment for type 1 diabetes was a low carbohydrate diet. That's a clue, isn't it? So you don't have high levels of glucose in your blood. But type 1 diabetes, I get nervous about people with type 1 diabetes taking both Lysulin and insulin, because if you do that, you may get hypoglycemia. That said, Dexcom, continuous glucose monitor, has a hypoglycemia alarm. So I've had about 20 volunteers try Lysulin, and many of them, like I said, about 60%, see their A1C improve, and they need less insulin than they did before, which is a good thing because insulin's expensive. And also type 2s are 33% of type 2s are also put on insulin by their doctors, which I think is almost criminal. And I've got some type 2s they also happen to be Dexcom users, and they also see an improvement in their A1C, getting it down in the low sixes, and they use less insulin. So I've got some fabulous testimonials from people about how it's helped them, allowed them to use less insulin and also to get off of metformin and stuff like that. So
yeah, that's great. Yeah, because I know our program too, Doc, we've seen with type 1s, we don't see a lot of type 1s, but when they do join our program, obviously we can't reverse type 1, but we've seen, kind of on average about an 80% reduction in the amount of insulin they have to take, which, as you said, again, less insulin, the better. Because number one, it's expensive. Number two, it's an artificial insulin, so it becomes toxic to your body as well. So the less you have to ingest insulin, the better, for sure. And again, as you said, a lot of type 2s get put on insulin. And, typically what I've seen in my experience for 30 years is that, most physicians will start their diabetics off on the oral meds, but then once they max out with maybe 2,000 milligrams of metformin, maybe 40 grams of glyburide or something like that. Once they're on about 2 oral meds and that's still not managing the diabetes, then they say, well, we got to put you on insulin now. And so they put them on insulin as a last resort. And once they're on insulin, that's pretty much their physician waving the white flag, like there's nothing else I can do except increase the dose of your insulin. And I had the worst one I ever had, Doc, and I don't know if you've seen this as well. I've had the worst one I had about 10 years ago was a client of ours who was literally over 400, he's about 420 pounds, 6'6", big guy. He was taking 400 units of insulin per day, and his A1C was 13. So that kind of shows you that he was not only insulin resistant to his own insulin, his body was now resisting the artificial insulin because he was on 400 units and it still wasn't bringing it down. So that's when the doctor's like, there's nothing else I can do for you, right? They don't notice that, hey, dude, just stop eating your carbs.
It's like, it's like his insulin receptors are totally glycated, and the insulin doesn't fit in that. So, the blood levels stay high. And really, it's like giving somebody insulin is like you said, and we said, this is going to be getting old news here, but it's like that does not really help them. All that does is artificially, if you load up enough insulin, if the key fits in the lock like 20% of what it should be 100%, well, okay, if you put 5 times as much insulin in, maybe a little bit of glucose will get removed from the bloodstream, but it's like totally stupid. It's just, if all those doctors who put their type 2 patients on insulin would just try Lysulin for 2 months, 70% of those people, 70% of that 33% who get put on insulin, 70% of them would not have to go on insulin. That their insulin resistance would improve, and their natural insulin would work so much better that they'd not have to have insulin shots. But it's impossible to get that story out. So I'm really happy to be here to tell. At least you and I can talk about it. I hope a lot of your listeners will appreciate this story. It's true.
And so how long does it take for Lysulin to work and for people to see a benefit typically?
That's a great question, because we have so many people that will buy a single bottle, and we have capsules, tablets, liquid, and powder, and we just launched a weight loss meal replacement shake, and we'll have people buy a bottle of capsules, let's say, and 2 weeks later they'll say, I want my money back, it doesn't work. And, it takes a month. And I've actually published a study on some volunteers who started Lysulin, and we followed their fasting blood sugar and their A1C. And the A1C actually dropped faster than their fasting blood sugar. And that's not unusual. That's actually, there's an ADA publication that also substantiates that A1C will drop faster than fasting blood sugar, but it takes a month. So if people will just give Lysulin a month, 70% of them will see an improvement in their blood sugar and in their A1C. I know I had another story about the ADA and medical doctors in the drug industry. It's like when we launched this in 2018, I wanted to go to the ADA and have a little exhibit there to let people know about a new natural treatment for prediabetes and type 2 diabetes. So I sent my $5,000 for a little 10-foot table. And 2 weeks later, I got an email that said, we're sending your money back. You can't exhibit here. And I said, well, that's odd. So I called them and I said, what's the matter? I paid you my money. Why can't I come to the show? Oh, we have a policy. We don't allow vitamins and supplements to exhibit at our convention. Why? Because Big Pharma pays for it. And they don't want, non-prescription items to be sold there.
I tell our people all the time too, Doc. If you look at the American Diabetic Association monthly magazine, you start flipping through that thing. 90% of the ads are from Big Pharma, so it's totally bought and paid for.
Yeah, it's all drugs, and all the publications. In addition to the ads, all the publications are. Well, there's two actually things now. One is drugs, primarily drugs, and the second one is continuous glucose monitoring. I like the second one. I hate the first one. So, yeah, it's a tragedy. Our healthcare is such a mess. And I've written emails and letters to all of the living presidents, the Secretary of Health and Human Services, who else? Everybody I can think of, telling them if they want to have a legacy for their administration, end type 2 diabetes. It's a war that can be won, the war on type 2 diabetes. And all it takes is for the government to flip that pyramid upside down and follow the guidelines that you do when you reverse diabetes and get people off drugs. But I can't get anybody to respond. They're not interested. I don't know.
Well, and I'll give you another story too. For about 10 years, Doc, when I was started our diabetes reversal, obviously we're not the ones taking them off their meds. We just show the patient how to change their lifestyle, right? And then when the numbers start coming down, we tell them to call their primary physician, and they'll be the ones that wean them off the meds, right? So that's why we're not stepping into the primary care role. So their physicians know that their patients are getting better and they're weaning them off their meds. So we would always ask our patients, when you're done with our program, go get another set of labs from your doctor and send those to us so we have the before and after. So then we would have those before and after, showing that the A1C went from like 8 down to 5.8 in 4 months, and now they're off their diabetic meds. And I would send a nice letter to their physician saying, hey, doc, we have a mutual patient, Mary Smith, and as you know, you were able to wean her off of all of her meds. I've enclosed the pre and post lab test just to show you, blah, blah, blah. And I said, hey, if you have any other diabetic patients that you think might want to get the same results Mary did, please send them to me. I'd be more than happy to take care of them, right? You know how many referrals we got, doc, in 10 years? 0. Not even 1. I'm like, that baffled me. Like, how can you see that with your own eyes? You saw that you're able to take them off the meds. You saw the A1C is normal, and they still would not send anybody to us. And that baffled me. Like, it's almost I think I realized, doc, that it was embarrassment. That they were embarrassed that Mary was a patient of theirs for 10 years, and under their care, her diabetes got worse. More meds, more kidney disease, and in 4 months with us, we're able to get them off of all of it. And so I think they were embarrassed, like, wow, I feel bad. How come I didn't know? But nobody had the integrity or the character to say, you know what? That sounds great, Dr. Hawkins. How did you do that? Let's work together. Nobody did that. It's just like, to this day, I just don't understand.
It just occurred to me, actually, they make a big deal about it, the Hippocratic Oath. Above all, do no harm. Well, they are doing harm. And after you tell them, doc, you're doing harm, prescribing all these drugs and insulin for people with diabetes, that doesn't need to be. You are not observing your Hippocratic Oath if you don't start using these methods for all of your type 2 patients. You know what I mean? It's like, how can they not see that they're doing harm? It's so strange.
I've been doing, type 2 diabetes reversal for 13 years exclusively. And in that entire time, I only have 2 medical physicians that actually get it. They're actually on our medical advisory board. One's in New York, one's in California. And they were concierge medical doc, but both board certified medical physicians, family practice. And now they're using our program in their clinics because they had enough self-esteem, I guess you want to call it that way, to realize that they were wrong the way they were doing it for the past 25, 30 years. And now they've embraced it. But it's like a unicorn, as we talked about, for them to find somebody who's like, wow, I had no idea. Yeah, let's do this because of the Hippocratic Oath, and they do want to help people, but they just, nope, it's like over their head, or I don't care, it's hocus pocus. I know you and I were like preaching to the choir with this because it's so frustrating that how do they not get that? I mean, these are caring, smart, intelligent people, yet they just like, whoop, it's like this tunnel vision where they just like this veil is over their eyes. It's amazing.
I'm surprised you found 2 MDs to get on the program with you. So that's really fabulous.
So now, so how does someone actually take Lysulin? I know you mentioned it comes in pill, capsule, liquid, powders, so there's multiple ways, right? They can take it.
Yeah, when we started the company in 2018 with our first product, it was a 3 big pills a day. And everybody complained about the size of the pill. And the problem was we had to get 3 grams of lysine a day into their bloodstream. So they were big pills. And everybody said, oh, these are too big. I can't swallow these, blah, blah, blah. So we came up with a chewable tablet, which you have to take 6 a day. And of course, there's a bunch of people that didn't like some of the ingredients, or they didn't like the taste. And so then we came up with a capsule, and now we also have the liquid and the powder, which is a once-a-day powder, and we just launched in the weight loss shake. But the capsules and the chewable tablets, you have to take 6 a day. That's why I love the liquid, which is 3 teaspoons a day, or the what's the liquid? And now the once a day powder, which is 1 little scoop in a cup of water a day, and it's all done. But there are a lot of people still prefer to take the capsules or the chewable tablets. The chewable tablets I like the taste. Some people don't, of course, but it's there's a whole 5 different formats, and with each, it's basically whatever that works best for the patient is fine with me, as long as they try it and they keep at it for at least a month. And we also sell a home test for A1C, which I happen to have here. And this is a test that you can run at home, and it gives you your A1C result in 5 minutes with a little blood stick sample that you put on the test strip. So the people, I love the product. It costs too much. That's because we don't make it. But the people that buy the product, if they buy a bottle, they can test themselves before they start Lysulin and get their baseline A1C, and then a month later, and 2 months and 3 months later, continue to check their A1Cs and see how well it's working for them. It's a fabulous product.
All right, so before we go, last thing I want to give you a chance to talk about is I know you have the spray, as we're still in the kind of tail end of this COVID. I don't want to say what I want to say about it, but we're in this COVID thing. So tell us about the spray so people can maybe get that product too if they're still concerned about COVID-19.
Well, I love this product, and it's a good story on how I got onto it, because when I launched Lysulin, I went to LinkedIn, and everybody that had something to do with diabetes in their description, I contacted them and introduced them to Lysulin and the science story behind Lysulin. And one of the folks that I contacted was a podiatrist, a medical doctor, podiatrist. He loved the science story, and he actually wrote a little blog about me fighting glucose toxicity. And in part of our discussion, he said when he was in practice, as you know, people with diabetes have wounds on their extremities that don't heal properly, on their feet especially. And there's 2 reasons those wounds don't heal. One is because their natural healing doesn't work because their circulation is so poor, again, because their bloodstream has been glycated to where it shrinks up. And the second reason is because they have germs growing in the blood, in the wound bed. And so he said there was a product called, what was it called? Ultramist. And this was a little gun that was connected to a bag of saline, and the gun used ultrasonic vibration to turn the saline into a mist. And he said, when I used that product, the healing I got was miraculous. He said it stopped gangrene and all these other stuff. And I said, oh my God, haven't I ever heard of this? So I contacted the manufacturer, and he was a Russian engineer. He was the CEO of this Ultramist company. I said, what does one of these cost? He said, $30,000. I said, what? That's crazy. Why don't we work together to make one of these less expensive, so a lot more people can use it on their wounds and improve their health? No, I'm not interested. I've got 50 patents, and the parts are too expensive. He emailed me a week or 2 later and said, well, for $3.5 million, I'll give you the non-exclusive rights to one of my patents. And I said, well, I don't have $3.5 million to throw at this, but I will pay for the development of a prototype. We'll both manufacture it, and I'll pay you your $3.5 million out of royalties on the sales. No, I'm not interested. People don't pay for licenses with royalties, which is totally stupid, because that's how most people pay for them. So anyway, I went to Alibaba, and I searched for a nebulizer that might possibly be used with saline. And sure enough, I found there's a bunch of manufacturers of these little nebulizers. I've actually got one here that's like this. So you put the solution in here, and you just open this up and push the button. And I don't know if you can see the spray coming out of it. So basically, I ordered a dozen of these, and I sent them up to a lab in Burbank to do bacteriology kill time testing. And 2 weeks later, I got some bad news and some good news. The bad news was the ultrasound in this little gizmo was too weak. It didn't kill any bacteria. The good news was that same day I got an email from this wound care internet organization I belong to, introducing me to hypochlorous acid, HOCl. And HOCl is what your white blood cells use to kill all germs. It kills bacteria, virus, yeast, mold, and fungus. So I bought some from a manufacturer and sent it to the lab in Burbank. A week later, they emailed me back. In 15 seconds, it totally killed all the bacteria. So I said, wow, I have got to get this stuff out. So I contacted the manufacturer of hypochlorous acid, HOCl, and I said, I'd like to sell this to consumers. They were trying to sell to doctors, which is, I said, is like beating your head against the wall. But anyway, so I said, and I'd like to private label it, and I have it now, and it's called Wonder Spray, and it's totally safe and non-toxic. You can spray it in your eyes, your nose, your mouth, and on your skin. In addition to wound healing, it's great for any skin problem. If you have itching, burning, mosquito bites, poison ivy, eczema, rash of any sort, it'll help it heal so much faster. And I had a woman who had an eye infection. It cured it in like 4 days. It like totally wiped it out. And if you have a sore throat, you just spray it in your throat like I just did. It will immediately make your throat feel better and kill whatever's trying to make you sick. And Wonder Spray is now registered with the EPA for COVID-19 disinfection. And we also sell foggers that you can use to fog your home, car, office, any place people get together to keep it disinfected and deodorized. It's a really great deodorant too. And by a whole other mechanism, amazingly, it also relieves allergy symptoms. So I can't believe I stumbled upon this product. It's just but again, getting the word out, amazing. Nobody knows about this, even though the active ingredient was discovered in the late 1800s, and it was used on the battlefield in World War I for wound healing. The problem was it wasn't very stable, but the manufacturers now have it so that this little bottle lasts for a year from the date of manufacture. So that's a long-winded explanation. Yeah, if I have any questions, I hope you do.
No, that's great, John. I love it. So basically now, as we're closing, what are the two websites? I know it's the Lysulin and the one about the Wonder Spray. So what are the two websites where people can go to get more information on Lysulin and the Wonder Spray?
Yeah, if you go to www.jburd, that's my website, jburd.com, there's links to both websites. But the websites themselves are lysulin.com, and Wonder Spray is www.thewonderspray.com. There's another website called www.wonderspray, and that's not us. That's another wacky product. But the easiest way is to go to my website, and there's information about both products on my website and links to both of the product websites. Thank you for asking that question.
Yeah, so we'll put the links at the end so people have easy access to that. So I definitely want them to get more information about you, because again, we could sit here for hours, I know, Doc, because again, it's nice when you talk to somebody who gets it and understand really what's going on out there. So I really appreciate you coming on, best of the best, because you're in that category of best of the best. So appreciate our friendship we're developing. I know it's going to be a lifelong one, and anything I can do to help you as well. Just keep doing what you're doing, man. I just love it. So again, thanks for being on the show, and I will talk to you soon. Everybody, thanks for watching this episode of Best of the Best, and we'll see you on the next episode. Take care.